As a Region X provider, when we say Region X is the authority in these autologous stem cell, orthopedic stem cell procedures. So me being in Dallas, and I'm the only Region X provider in Dallas or Texas, the whole of Texas, and in Oklahoma. So we will provide the top quality care, which has been backed by significant research. Most of our Region X network is fully based on data. So we're talking about our own data. So the Region X as a group have collected significant amount of data over the last several years, because we have done most number of procedures, we follow them, we have full-time researchers working on it. So that would help us. So we would say we're much better this year even compared to last year's, and we're going to be much better next year thanks to our our research team and data and our patient feedback basically. So in Dallas, when we started this thing a few months ago, there was tremendous response. Patients are looking, hey, oh, we have something available now, and there are also a lot of skepticism, like, hey, what is this? We hear this thing, only some athletes getting it, so is this safe, is it not safe? So when we started in Dallas, and those were a lot of questions, but again, once they get a little familiar, we educate them, and this procedure has almost become a mainstream right now. It is not that elite athletes anymore. This is a significantly very commonly affordable procedure these days, considering the benefits you're getting out of this procedure. So we are getting a tremendous, I would say, interest in this procedure. When we started in Dallas, and we've been getting patients from all over Texas, surrounding states, wondering about what are the stem cell procedures for their knee joint, for their ankle joint. We have a lot of rodeo athletes as well, rotator cuff injuries. We have degenerative patients with the wear and tear of the knee meniscus, hip arthritis, lower back spine problems, and we have the young students and athletes as well. So there is a wide spectrum of patients that have minimal issues with their joints that does not need surgery. There are always those end-stage patients that it's too late for them, and they may need a surgical alternative. But again, if you catch them early or mid-stage, moderate level of arthritis, there's a significant amount of relief and improvement that we can provide these days. And the Dallas area is huge. Dallas area is huge, and the amount of patient inquiries we've been getting was significant there. And again, as I said, like when we started versus now, there is a lot of familiarity about these procedures for a lot of people. There's so much online that they can read about it. So when they come in and we explain it to them, and they have already seen one of their friends or family members get a procedure done, and they see them like walking great and no pain, and then they say like, hey doc, can I have this thing? So we have our office locations in Grapevine, South Lake area. So that's closer to the highway, and again, as we said, like the Region X has multiple offices throughout the country. At the present time, we are like 26 physicians doing similar procedures. But in this area, so I will be the one doing in Dallas Region X stem cell procedures or plasma-rich platelets. So we typically have the same protocols throughout the country. That's one way of maintaining the quality control. So we can definitely tell like we all move forward together, because this is an evolving field. So we're getting better and better every year. More and more options are coming in. So we're very excited to be in that market, and trying to help a lot of people that are in need, and a lot of people are just waiting. Some of the people think like, okay, surgery is my only alternative, but I'm too young, or I'm not there, so I have to suffer until 5-10 years old. So these are the kind of patients that are showing up in our Dallas office, calling us, and we have a significant amount of treatment options that are being made available these days.